Care consolidation, it actually, essentially there's just two parts to it. Number one, we wanted to match this patient to one principal doctor that mainly takes care of this patient holistically. And because this doctor would know this patient inside out, and by knowing them better, having better rapport, they'll be able to reduce all the other appointments that they have, which maybe sometimes is taking one small part of their healthcare. So simply put together, care consolidation meant finding the right doctor who would then be the principal doctor for this patient, and at the same time, as a side effect, reduce the number of unnecessary extra appointments that the patients have to go through. So it makes a lot of sense because our patients were elderly. They need help to get to the hospital. And if they can reduce the number of times to see less number of people, then it would actually help them come to the hospital easier, you see, in a sense. So the vision was very simple. Designing what would that mean to a patient. We actually tried very hard to approach design thinking kind of a way, that we wanted to provide it from the patient's point of view and the caregiver's point of view, and what were their pain points and what would they expect from something like this. And therefore, in the process of creating this, we kept them very much at heart. So it's been running since 2019, and I think a good number of patients have been enrolled into this program. We find that they are very happy from three main aspects. Number one, they are seeing the same doctor, which, as you know, a familiar face is always very nice especially when you're in a hospital, right? You don't want to see someone who's different all the time and, oh, I know, I've seen Dr. Tan before, he knows my problems, he knows my family, he knows what I need, right? So having a familiar face who provides care, not just specialized care, but also taking care of every other medical need that you may need, it was very comforting towards the patients. That's the first thing that they really look up to. The second and the third thing may be a little bit related, where number two, I think they appreciate the fact that they save time. Less appointments, less time spent in traveling, waiting, and also while they also save time because they don't have to take so much time off work, right? We have patients who are working till a good ripe age. We had an excellent team that worked very well together to make this transformation happen. Basically, everybody came from different backgrounds. We had a nurse, we had a social worker, we had a care manager, we had a doctor, we had a pharmacist, we had the therapists in as well. And therefore, when we designed this process, which actually, think about it, is only matching the doctor to the patient and trying to reduce appointments, but because we did it through everybody's eyes, we were able to see things that we've never seen before. Now healthcare is redesigned towards providing for this group of patients who we know a lot of Singaporeans are going to live very long moving on forward. Lifespan is going to be much longer. And these are the problems that we anticipate will come. So the team felt a lot of gratitude and a lot of appreciation when we received this award, because we know that we are anticipating what's coming.
I want to take this opportunity to also thank people in the hospital for encouraging us, for giving us a lot of support, and especially during the pandemic times, to help us get through this, to be able to deliver what we want to and more for our patients.